From a pharmacy standpoint, the first big opportunity to really help the patient is during the admission, medication history, and reconciliation. Do you want to improve the quality of care for your patient, the patient's safety and satisfaction? Get an accurate medication history and reconciliation complete. This is a broken process in healthcare. The National Institute of Health Research shows that medication discrepancies are so common that they affect up to 70% of patients during hospital admission or discharge. Approximately 1/3 of these can harm patients, including adverse drug events that lead to hospital readmissions. That means approximately 1 out of every 4 patients have a medication discrepancy that could be harmful to them and prolong their hospital stay. Patients go to the hospital to get better, to be treated, not to possibly have more harm caused to them due to the lack of information. I am not surprised at the complexity of the challenge that must be faced in order to manage the drug plan. There are a lot more drugs on the market, a lot more chronic and polypharmacy patients. It is a complex process with a lot of data points. We understand the magnitude of this issue, and we implore all providers to take action. The percentage of medication errors estimated to result from inadequate medication reconciliation is 40%. We must focus on this from the moment a patient is engaged in the care process. Consider this. A very sick patient arrives in the emergency department. XchangePoint's targeting algorithms are activated, and the patient is targeted for a medication history and reconciliation. Utilizing XchangePoint, a member of the pharmacy team sees that the patient is on more than 10 medications and has a gap in proportion of days covered concerning several of their critical prescriptions. This individual is also a geriatric patient, and one of his medications is highlighted as particularly risky for the elderly according to key quality measures. So as a result, the individual is flagged as a patient for further intervention. During their stay, XchangePoint's workflow will be utilized for bedside delivery of discharged medications, as well as to document a consultation with a member of the pharmacy team prior to their discharge. These proactive elements ensure that both the patient and his caregivers fully understand the medication treatment plan. XchangePoint is an integrated workflow management system supporting medication management across care transitions. We designed it for pharmacy and care team members to drive medication optimization for at-risk patients in acute, post-acute, and ambulatory care settings. XchangePoint reduces medication errors, improves patient outcomes, reduces hospital readmissions, and increases patient safety and satisfaction. It has the flexibility to interface with the hospital's EMR for enhanced workflow opportunities, or it can be utilized without an interface for quick and easy implementation. To date, XchangePoint has provided more than 100,000 accurate medication histories for patients, and we have seen an 85% decrease in medication errors at admission. XchangePoint enables health systems to eliminate the confusion about medications, drive better care, better safety, better satisfaction, one patient at a time.